Good morning to all. Today I am going to discuss about a very important topic, that is conduct disorders. So, what is a conduct disorder? Conduct disorders are characterized by a persistent and significant pattern of conduct in which the basic rights of others are violated or rules of society not followed. In conduct disorders, the individual or it's mainly occurs during the adolescent or childhood period. During that period, the child or children may develop some conduct or violate some rights of society, and which leads to aggressive behavior or punishment, etc. Then the diagnosis is only made when the conduct is far in excess of the routine mischief of children and adolescents. The onset is usually occurs much before the 18 years of age, and usually even before puberty. So the conduct disorder is usually seen or occur before 18 years of age and during the time of puberty. Then the disorder is much more common in boys, especially the 5 to times more in boys than girls. And in ICD-11, conduct disorders are classified under disruptive behavior or dissociative disorders, oppositional defiant disorder, and conduct dissocial disorder. Then, what are the etiological factors of conduct disorders? So, the first etiology or first cause is genetic factors. Monozygotic and dizygotic, as well as with non-twin siblings, have revealed a significantly higher number of conduct disorders. They state that monozygotic and among the monozygotic and dizygotic twins, non-twin siblings are more affected, and alcoholism and personality disorder in the father is strongly associated with the conduct disorders. Alcoholism and also the personality disorders among the parents also influence to develop the conduct disorders among the children. Then the second etiology is biochemical factors, which includes there is a correlation between elevated plasma levels of testosterone and aggressive behaviors. Biochemical factors mainly state that there is an increase in the testosterone level or plasma testosterone level may causes aggressiveness or aggressive behaviors among the children, and that leads to the conduct disorders. Then the third factor is organic factors, and which includes children with brain damage and epilepsy are prone for developing conduct disorder. So organic factors mainly focus on when the children or the parents they having any brain injury during the pregnancy, or children having any brain injury or epilepsy or seizures, that may also prompt to develop the conduct disorders among children. So that's the organic factors contributing to the conduct disorders. And the next factor is psychosocial factors, which states a home environment that lacks structure and adequate supervision, with frequent marital conflicts between parents, then parental rejection, then inconsistent management with harsh discipline, then frequent shifting of parental figures, then large family size and absent father. There is a conflict between the parents or mother and father that may also lead to develop the conduct disorders among the children, and also parental rejection, then frequent shifting of the parental figures also contribute to develop these conduct disorders. Other than that, the psychosocial factors that consist of parents with antisocial personality disorder or alcohol dependence. That means the person or the parents having any antisocial personality disorders that contribute to develop the children with the conduct disorders, and parental permissiveness, then marital conflicts and divorce in parents, association with the delinquent subgroups, Then inadequate or inappropriate communication patterns in the family, living in low socioeconomic conditions with overcrowding and unemployment. The low socioeconomic status of the parents or family, and also the misunderstanding or lack of communication among the parents also leads to conduct disorders in children. That leads to developing the conduct disorders among the children. So that's all about the etiological factors of the conduct disorders. Next, move on to the risk factors of conduct disorders. The first one is being a male. I am already told the boys are 5 to 6 times common than girls to develop these conduct disorders. And then living in an urban environment. Then poverty, also told low socioeconomic status of parents that influence to develop or that prone to develop the conduct disorders. Then a family history of conduct disorders and a family history of mental illness. That's also about the risk factors of the disorder. Then having other associated psychiatric disorders, parents with an alcohol or drug addiction, a dysfunctional home, history of experiencing traumatic events, being abused or neglected. Then what all are the clinical features of these conduct disorders? The first one is fighting with family members and peers. I am already told in the definition, the conduct disorders that characterized by violating the rules or rules of the society or the family, and fighting with family members and peers. Then frequent lying. The boys or the affected individual or the children may tell everything in the lying format. Then stealing or robbery, then running away from home and school, then deliberate fire setting and breaking someone else's house, articles, car, etc. Then deliberately destroying others' property, cruelty towards other people and animals. They develop some of cruelty or negative impact on other peoples or animals. Then physical violence like rape, assaulty behavior, use of weapons, etc. Then secondary complications like drug abuse and dependence, unwanted pregnancies, syphilis, AIDS, criminal records, suicidal and homicidal behaviors. That's all about the clinical features of the conduct disorders. Next, move on to the diagnostic measures or how to identify the children having the conduct disorders. The first one is complete psychiatric assessment. A thorough psychiatric assessment will provide the features of the children or the behavior patterns of the children. Then academic assessment, whether the child is violating the rules or any poor academic performance. Then neurological assessment, that's mean whether the child having any seizure or epileptic activity. Then laboratory investigation, I am already told elevated plasma testosterone may leads to developing the conduct disorders among the children. So that's about the diagnostic measures. Then move on to the treatment modalities of the conduct disorders. The first one, the most common mode of management is placement in a corrective institution. So there is the primary management for the conduct disorders among children is put them into a corrective home or corrective institution. Then parent management training must include the family support and parent, especially the mother father bonding. Then anger management training, then individual psychotherapy and drug treatment. Then in case of epilepsy, you should administer the anticonvulsants or anti-seizure medications. Then hyperactivity, should administer the stimulant medication. And impulse control disorder and episodic aggressive behavior, lithium carbamazepine is the drug of choice. Then psychotic symptoms must administer the antipsychotics. And the next treatment is therapeutic school and juvenile justice system. Then the important part, the nursing intervention or nursing management. first one, the nurse should observe the child's behavior frequently during routine activities and interactions, and redirect violent behavior with physical outlets for suppression of anger and frustration. Ensure that sufficient number of staff is available to indicate a show of strength is necessary. It is a crucial responsibility or role of a nurse is to assess the behavior pattern of the children who they having the conduct disorders. Then administer tranquilizing medications as prescribed. Then use mechanical restraints or isolation if the situation cannot be controlled by less restrictive means. If the case or if the situation is very danger to staff, you should mechanically restrain the children by using the some of rope or the mechanical restraints. Then explain the patient that there is a correlation between the feelings of inadequacy and the need for acceptance from the others. Then set limits on manipulative behavior and identify its consequences. The nurse should observe the manipulative behavior and identify what are the consequences that made from that. Then provide immediate positive feedback for acceptable behavior. So the nurse should also encourage and provide the positive feedback if the children is positively corrected. Then encourage the child to maintain a logbook and make daily entries of his behavior. Then review the log with the patient before discharge. Provide social skill training by demonstrating the skills through modeling. Provide guidance and support to the parents. So in conduct disorders, so the main responsibility of the nurse is to identify the manipulative behavior and correct the action. If the case is very danger to the staff and all other members, including the children, affected children, you should mechanically restrict or restrain the children from those of manipulative behaviors. So that's all about the conduct disorders. And also the nurse's responsibility, encourage parents to verbalize feelings of guilt and helplessness in dealing with the child. And the nurse should emphasize on close collaboration between parents and school personnel. So that's about the nurse's responsibility of conduct disorders. So I'm already told conduct disorders means violating the rules by the children. Especially it is more common in boys than girls, 5 to 6 times more than in boys than girls. So in younger age, you should notice, if you are a mother or a father, you should notice the behavior patterns of the children. So that's about the conduct disorders. Thank you and have a nice day.